Welcome students to game 27, Gross and Microscopy Explained. This is a very simple topic, a slide that is kept for you, easy to identify. The term is inflammatory polyp. Inflammatory polyp is common in the nose and the sinuses. A polyp is a lesion that projects above the surface. And this can be asked as an MCQ, but slide is very common in all the universities. So there is a lesion that is projecting into the nostril leading to an obstruction. And these are the various sites where we can get the polyps. They can be either pedunculated or sessile. They can be solitary, sometimes multiple. This is the list of differential diagnoses we should have in mind. A polyp can be inflammatory, it can be allergic, which can again be treated as inflammatory itself. Or it can be because of a specific infection such as rhinosporidiosis, which we had already seen, and that is also a slide and a question for you people. And last but not the least, it can be a tumor, neoplastic, such as a nasal papilloma. A squamous cell papilloma can also be projecting as a polypoid lesion. Have these differentials in mind. So this is a beautiful microphotograph and this is the source of it. On one side, I am finding a pseudostratified columnar epithelium. Why am I saying pseudostratified? Because I am finding multiple nuclei in the same vertical row. So one is standing on the top of other. It gives an illusion. That is why it is called pseudostratified. Coming back to the slide as such, I am finding multiple cells with a somewhat pinkish cytoplasm, and this obviously indicates the eosinophils. There are some cells which are having a bluish nucleus and not so specific cytoplasm. They may be lymphocytes. Again, some lymphocytes are here, but the majority are all having a pink cytoplasm, hence they are eosinophils. Also, I am finding some blood vessels, which we call as congested. Look at this one. It is as though the blood is static over here. We call it as congestion. And this is the supporting stroma. The intervening area is the supporting stroma, and it is showing edema. So what all should we observe? The epithelium is pseudostratified, columnar. There is an inflammatory infiltrate, predominantly of eosinophils. You must see what is the infiltrate in the slide in your college. There is congestion of the stroma and there is also a marked amount of stromal edema. Rarely we may be seeing mucus glands, not prominent in this slide, but it can be seen. This is again a very beautiful picture, pseudostratified columnar epithelium, and there is a marked edema. I say edema because the cells are getting separated. That is how we identify an edema. In this also, I am finding some pinkish cytoplasm that indicates a eosinophil, but there are many lymphocytes which are also present. So section studied, it will be in fragments. They are partly lined by pseudostratified cuboidal to columnar epithelium. The underlying stroma is loose and edematous, and it is infiltrated with lymphocytes, plasma cells, or eosinophils. Very same over here. Only differences, I am finding a lot of these empty cells, which are the goblet cells. Plenty of goblet cells are seen. There are congested capillaries over here, and sheets of inflammatory cells, which are again lymphocytes in this case. Maybe a few eosinophils are also seen. I would like you people to compare these two because both are slides for you people. In one, I am finding the epithelium, edema, and dot-like inflammatory cells. These are the capillaries. So it is an inflammatory polyp, obviously. In another, apart from all this, I am finding a large sporangia. In fact, two sporangia are there, and they are filled with endospores. So it is a case of rhinosporidiosis. This is a pseudostratified epithelium that we see. So see you in game 28. Both of these are university exam slides. Please do remember.